So I'm Beth Mortars. I'm with the Sikh Human Rights Group. So we're an NGO that gained UN Exile status in 2015, and we work on promoting more rights-based approach and pluralistic language in actions and legislation, as opposed to more universalistic ones that only speak to a specific part of the globe. So I run our gender and our diversity projects, and for the past 2 years we've been lobbying for reform on how we discuss menstruation and ensuring menstruation is put on the agenda and tackles gender discrimination and menstrual injustice. So as an NGO, we have submitted written and oral statements at various human rights councils. Last year we submitted an oral statement at the panel on menstrual hygiene management, human rights and gender equality. We also submitted statements at the annual discussion on the rights of the child, rights of the women, and then also at this year's interactive dialogue on the working group of discrimination against women and girls. And at that conference, we made a statement saying how society is often using menstruation as a tool to discriminate against women and girls, which I'm sure we will discuss further on this panel. So in addition to those, we've also held 2 parallel events at the past 2 UN Women Commission on the Status of Women, and we tackled kind of the barriers that exist that prevent sustainable menstruation, as well as the other one that spoke about the innovation of menstruation, or rather the kind of selective innovation around menstruation. And we also raised the issue of menstrual injustice at both COP26 and COP27. And this is kind of at those COPs, they stated that women and girls are 14 times more likely to die due to climate change, and therefore there is a need for them to be at the decision-making table and in charge of resources like finance. Now my question was, if you want them to be at the decision-making table, then they need to be able to get to school and work. They need to actually be able to educate. So that was kind of the conversation we had there. But yeah, despite over 50% of the population experiencing menstruation at some stage in their life, we still see much of the world treating it as a luxury or as a choice rather than an involuntary natural occurrence. For instance, the taxing of menstrual products, and where not taxed, charging beyond the means of many, especially those living in poverty, is an example of gender discrimination. We recognise menstruation has been stigmatised, undereducated, and even used as a tool for discrimination. And we hope this side event will provide some answers on the steps that need to be taken to alleviate this discrimination. We urge governments to implement policies that provide free menstrual products in all public places. Such initiatives eliminate financial barriers, improve school and work attendances, and reduce stigma. Menstruation should be discussed as a vital aspect of health education, rather than just a hygiene topic. Broadening our discourse on menstruation, we can challenge gender-based tax discrimination. We can delve deeper into the health, the ethical and the environmental implications of menstrual products, and address the issues around gender equality, child marriage, reproductive health, education and water and sanitation with the gravitas they deserve. By ensuring access, affordability, education and safety, menstruators can live with dignity and without discrimination. So without further ado, I will kind of give a brief introduction of our panellists. So our first, I'm sure a lot of you have heard of, is Gloria Awoba. She's the senator at the Parliament in Kenya, who was meant to be here, unfortunately, has had to join via Zoom. So I really hope that works, but you should be able to hear with your headpiece. But yes, she has made significant impact in her 10 months in office, so she joined office in September 2022. Notably, she has spearheaded the Free the Period campaign, which aimed to end the period stigma and promote the availability of free menstrual products in Kenya. As a part of the campaign, she has made a powerful statement by choosing not to go home and change her trousers after accidentally staining her suit with menstrual blood while at the Senate, drawing attention to the urgent need for access to menstrual products in the country. Thanks to the collective efforts of Gloria and some of her partners such as the UNFPA, AIDS Healthcare Foundation and others, Gloria launched Glow's Pad Bank and her bill on the provision of free sanitary towels in Kenya. This initiative was a significant step towards addressing the issue of affordability and accessibility of menstrual products in Kenya and throughout the globe. Gloria is currently working with the Kenyan government to break down the NHM policy in Kenya to implement across all institutions and public spheres. So although Kenya was the first country to abolish the tampon tax in 2004, the persistence of challenges in accessing affordable menstrual products highlights the fact that removing the tampon tax alone is not sufficient. Gloria's campaign and subsequent actions has shed light on the ongoing need for comprehensive measures to ensure menstrual quality and access to affordable products for all who menstruate. We in person have Dr. Olivia Ahn, who also has worked with the UN Population Fund. So she is the CEO and co-founder of Floosh. Floosh was created to remove permanent waste from your bathroom and our planet with the microplastic-free flushable period products. Olivia worked for the NHS for 2 years and continued to develop Flush Tech, the material technology behind Floosh flushable pads. In 2019, Olivia went full-time into Floosh, and since then has been the innovator of 2 global patent families, awarded the NatWest Chairs Award, London Mayor's Entrepreneur, MSD UK's Innovator of the Year, and raised over $12 million in funding for Floosh. Olivia is passionate about reinforcing the conversation of the burden of sustainability away from the shoulders of the individual consumer and back in the hands of corporations designed, developing and selling products that make waste, the permanent waste that we see with menstrual products. We have Judith Kaula, who is the Joint General Secretary of the Guru Singh Sabha Gurdwara in Southwood in London, a respected professional in asset management industry. With deep commitment to the Sikh community, she plays a vital role in the governance and management of the Singh Sabha. She champions the empowerment of women, advocating for the equal representation and opportunities within the community and beyond. SHRG and Floosh are working closely with the Gurdwara to provide free menstrual products in Gurdwaras to showcase the need for free menstrual products to be available in all public bathrooms, but particularly schools, places of worship and places of work. And we aim to present our findings at COP28 and CSW68. And last addition to our panel, we have Alonso, who I think we already all know, but the incredible Deputy Director of the United Nations Population Fund, who has been campaigning exceptionally hard for better access, education and understanding around menstruation, and was a part of the panel on menstrual hygiene management and human rights and gender equality that we saw last year at the 50th Human Rights Council. So I will pass to people you actually want to hear from. So we have Gloria. So the first kind of question for Gloria to tackle, I suppose, is Gloria, if you could talk us through why you feel it took 19 years for a bill to be implemented, and how Kenya is an example of where simply removing the tampon tax is not enough when tackling period poverty. You're on mute, Gloria. I'll start with another question, and then we will go to Gloria if how technology works. So, Dr. Olivia Ahn, as you work in the pad industry, could you give us an insight into what steps Floosh are taking to ensure the burden is not on the consumer when it comes to both affordability and ensuring we are acting sustainably?
Thank you so much, Bethany, and thank you so much for inviting me here to speak today. I'd love to talk about 2 core principles. Firstly is around consumer behaviour. We need to create products that promote an intrinsic human behaviour. After decades, sorry, do I need to turn this on? Can you hear me now? Okay, sorry about that. So firstly, talk about 2 core principles. So firstly is consumer behaviour. We need to create products that promote an intrinsic human behaviour. After decades in the United Kingdom, after a Do Not Flush campaign to protect our waterways, we see this year a survey of over 2,000 people saying that 36% of menstruators in the UK are flushing all unflushable products. And of those that flush, 52%. Oh, Gloria's there. Back to Gloria.
Well, you continue.
Okay.
Gloria will come back to you. We can hear you now.
And of those that flush, after 37% of menstruators that flush, 52% do it every single month. That is a horrifying statistic to learn after decades of a campaign saying do not flush. So clearly it is unreliable to expect consumers to use products through a learned behaviour consistently. So we should be building products that rely on an intrinsic kind of human behaviour, and especially, for example, for menstrual products where you're finishing in a toilet often, why not use an existing infrastructure that is piped in to take away and break down your waste? But this alone will not ensure sustainability or affordability. Right now, you'll have a product that consumers will want to use and use correctly. So next comes the second principle around corporate responsibility. And this has been all built on the Pareto principle, where 80% of consequences come from 20% of causes, where the concept of individual action of a carbon footprint was created and introduced by BP, but rather puts the ridiculousness of an individual carbon footprint in context of an industrial sort of scale. For example, in the UK, a British citizen for 80 years eliminating their carbon footprint is the equivalent to 1 second of the UK energy industry. So clearly we need to be looking at the places that will make the most amount of gains, and that starts with the industry. Companies creating, manufacturing and selling products must design with the entire product life cycle in focus. Until now, the majority of life cycle assessments and product analyses have ended at the factory gate, which have meant that we've seen innovations at the beginning of life. We've seen a substitution of materials, which is fantastic in the fact that we reduce our reliability on unrenewable sources. However, this just pushes the idea of permanent waste further down the stream, as we are just not measuring or calculating. By ensuring we go cradle to grave, we can ensure that we see a circular approach to product development. So, now that we've got a product people want to use and is more sustainable, we need to drive affordability, and that can be done through scale and a collective movement within the industry, but also within the private sector, driving investments into, I would call scalable cornerstone technologies, material technologies or software technologies that can be applied across industry, for example, food packaging, beauty, industry, waste, hygiene products, but also cross-market, so we can rapidly scale and reduce the cost for sustainable products worldwide.
Thank you, Olivia. Gloria, if you can hear us now, if you could unmute, and yeah, if you need me to repeat the question, I can.
I can go ahead. Can you hear me now? Is my sound okay?
Yeah, we can hear you.
Okay. Yeah, so why has it taken 19 years for Kenya to make strides in terms of the legislation that we had and the ending period poverty? I would say it's not only about taking out the taxes on the menstrual hygiene product, and it's not only about legislating. One of the things that was clear is that the first legislation that was in terms of provision of sanitary towels was not actually well drafted. I would say it was difficult to implement. For instance, so many things were left out to political goodwill, like what is budget allocation, what is the frequency, the number of sanitary towel packets that we give, priority schools, who actually decides which schools are more vulnerable than others. So the law was drafted indicating that there is intention to actually give out sanitary towels, but the way it was drafted does not really, the accountability part of it was difficult. So that's one of the reasons. In my opinion, I also think taking out taxes, what it did is taking out taxes from the menstrual hygiene products. What it did is it actually pushed a lot of the distributors import menstrual hygiene products from outside. So what is the repercussion of that? Is that we are trying to end period poverty. The issue here is poverty. How can we turn this billion-dollar industry into a direct benefit of the consumers locally in Kenya? So you have the tax, the rates, the tax taken, the importation tax taken out of the finished product of sanitary towels that are coming in from outside the country. But then, whereas the local manufacturers are actually having to pay tax for the raw materials that they are importing to locally produce the sanitary towels. So that means automatically it becomes less of an advantage to locally manufacture menstrual hygiene products, and actually the profit levels are way lower than if you are going to import. that means then you are not creating jobs within that industry, you're not dealing with the issue of poverty, which is the lack of resources for girls and women to buy sanitary towels. So we're looking into the issue of not just the market, it is how do you push the local manufacturers, how do you create jobs, how do you make sure that this billion-dollar industry, the beneficiaries are within that the communities where we are trying to solve the issue of lack of access. I also think there was not enough sensitization. You know, Kenya is the first country in Africa to launch the menstrual hygiene management policy. And very few institutions, very few stakeholders, very few beneficiaries of the same actually even know that it's happening. There is not enough sensitization, capacity building around what this policy is all about. What does it mean for a hospital? What does it mean for a school? What does it mean for the employer? Management policy that we have in Kenya. So a lot of work is done on that level, breaking down the policy in terms of action points. You know, for instance, we have the fire safety policy. Does that mean how many extinguishers after how many meters the extinguishers in terms of servicing the fire department? It's like that. So the menstrual hygiene management policy is there, but it has not been broken down into the action points and the different institutions who are going to implement it. You can see it's not a basic issue of taxes and a policy. Barriers, unfortunately, within our context. Particularly, I will speak for Kenya. I know most of the African countries share the same cultural barriers. The taboos around menstruation, the do's and the don'ts that are actually limiting women and girls to be able to talk about issues around menstruation, to sensitize themselves in terms of what are the right materials to use in this period of menstruation. So these are just, I'm just touching on the top of the reasons why I think it has taken us that long. And you can see that where the law is in Kenya, it is completely dependent on the political goodness. So right now we have a government that has come in, and due to the campaign that I have been spearheading from Kenya and across Africa, our budget in Kenya has moved from 260 million set aside for provision of sanitary towels to 940 million, just a little bit shy of 1 billion Kenya shillings. So what I'm trying to do is to ensure that we don't leave out the legislation to political goodwill, that we actually draft laws that are implemented and holders accountable. I believe that those are some of the challenges that we are experiencing after these many years of taking up the practice in menstruation.
Gloria, thank you so much for that, and yeah, again, well done for the incredible work you have done and continue to do in Kenya. So, duties, keeping in mind that often a bathroom is 100% prepared for a man and 50% prepared for a person who menstruates or a woman, could you tell us how important it is that a public place and places of worship like the Gurdwara you work at provide menstrual products?
Thank you so much. Yeah, thank you for having me here. It's a pleasure to be here. As you've mentioned, women and girls do have specific, unique physiological needs, and so toilets should provide all the provisions 100% like they do for women. They just, I guess, to ensure equal access and to promote gender equity. There's a number of things that currently aren't provided across bathrooms, across toilets, when we're sort of out and about. And I think sort of the main one here in the conversation is menstrual hygiene. And so, menstruation we all understand is a natural biological process experienced by women and girls, and requires appropriate facilities to manage hygiene effectively. Therefore, we should make sure the bathrooms and toilets are accessible and well equipped and clean and well stocked with sanitary disposal units and access to clean water, which is crucial to support women during their menstrual cycles. And there should be products available, as has been mentioned, and there should be support, to make sure that women have spaces that they can go to and they're fully provided for. Alongside that, there should be additional facilities when it 100% equity for women. For example, women that are postpartum or women that are pregnant, they might require additional support, and currently restroom facilities just don't have the adequate space, the accessibility, and just facilities to ensure that personal care is available and there for their comfort and well-being. And then finally, women's health. So, women may also face other health issues that require restroom facilities, and again, these aren't really accounted for. So if we consider all of the physiological needs and ensure that the restroom facilities meet all of these, we can promote that inclusivity, the comfort and dignity for all individuals, whether male or female. So it's sort of essential to recognise and address the difference and the diverse requirements for women to create equitable and accessible spaces for both genders.
Great, thank you. And yeah, I think we've kind of learned, or I'm sure we already know, but yeah, it's kind of point proven that there is this element of discrimination if you are someone who menstruates, again, fitting into a world that doesn't actually kind of work very well for you. And then the knock-on effect that has, whether that's the environmental impact or the gender data gap or the gender pay gap. So Alonso, I don't know if you kind of want to share some wisdom here in terms of this discussion.
No, thank you very much. No, I think it's a fundamental discussion, and thank you for inviting UNFPA to be part of it. Indeed, we have been here in Geneva following very closely all the processes that the Human Rights Council has undertaken for a stronger recognition of the human rights norms and standards applicable in the context of menstruation, and also as an operational agency as we are with 130 country offices and programs. Obviously, the work we do on the ground on menstruation is also fundamental for this conversation. And I was asked prior to this event not to try to wrap up some of the thinking that is emerging. And one very interesting thing when we look at the first of all at the discussion from the previous panelists, but also what has happened in the council at the last panel on menstrual hygiene management that was sponsored by the Mission of Gabon. And what we find is that there are a number of issues that emerge, or a few keywords that have emerged consistently in all those conversations, which are repeatedly taboo, social taboo, gender stereotyping and stigma, and gender discrimination. We saw menstrual products was the other word that was repeatedly mentioned. And here I want to make a connection with the previous panelists to emphasize that what we hear from all this is that menstruation is a complex phenomenon entrenched on those issues that I mentioned, taboo, social taboo, gender stereotyping, gender discrimination, because of which it needs to be addressed as a human rights, health and development issue. So menstrual products, of course, and consumer behavior is an important part of the problem and an important social determinant when we are looking at this from a health perspective and menstrual hygiene management perspective as well. But there's an array of many other factors that need to be addressed, and I would even say a need for a paradigm shift. A paradigm shift that doesn't put the burden on the consumer, which through education, through access to more accessible products, is going to be able to self-manage better their menstrual hygiene in a way that is also environmental friendly and so forth. But so how we make that paradigm shift towards a genuine rights-based approach, human rights-based approach to menstruation, which emphasizes that being a complex phenomenon, it requires a multi-sectoral response, that there are responsibilities, very clear and concrete responsibilities by different state officials in different parts of government, even I would call a whole of government response to this issue, which includes the Ministry of Education, in terms of prevention measures, which include ensuring access to comprehensive sexuality education, which has proven to be a fundamental tool in preventing complications and issues pertaining to menstruation, but also addressing the gender imbalances that are going to be fundamental when a girl reaches is at the onset of the first period, which opens the door automatically for a new array of human rights violations, whether we're talking about sexual violence, child marriage, retention in the school system or school absenteeism, etc. So, Ministry of Education has a fundamental responsibility. Ministries of Health have also fundamental responsibility of ensuring that menstrual health is integrated into a comprehensive package of sexual and reproductive health services, which at the same time need to be part of a comprehensive package of universal health coverage. This is fundamental because when we are talking about menstruation, sometimes a forgotten aspect in that conversation is the health complications. So it's not just an issue of hygiene management, there are a number of health complications that emerge from poor menstrual health that end up impacting the ability of girls and women to attend to school, to be at work. Menopause is another important dimension in that conversation, and all that needs to be properly addressed within health systems. What we have seen so far is sometimes from healthcare workers or professionals, sometimes a dismissive attitude towards menstruation, trying to dismiss that the menstrual pain is really a problem, or that menstrual pain is used as an excuse for labor absenteeism. So we really need to ensure that the health profession and public health systems, and the state as a duty bearer in that regard, plays its part. And something that Gloria said very clearly, I think, in her intervention, we also need to look at how government is addressing the structural factors of poverty that trigger all those problems that we are assessing, and how this reflects into budgeting and policy decisions. A rights-based approach precisely ensures, when we deal with these issues as an obligation of the state, it ensures that these do not become any longer policy options, but policy responsibilities. And so I will stop there with that message, and thank you again for inviting me to share this thing.
No, thank you for joining us, and yeah, that was excellently put. I think it reiterates the need for menstruation to be on the agenda. Whatever the agenda covers, it falls into that. I think that we have often seen, the menstruating body left off of the agenda, or off of kind of any research that's been done, etc., because it's too complex. And we even talk about menstruation in the sense of just the bleed rather than the entire cycle, and actually what happens during the different stages of the cycle, and actually how someone might feel during those stages, etc. You're even seeing it in sports in terms of you're more prone to injury. So there is so much more that needs to be understood and discussed, and hopefully it is starting to happen, slowly but surely. So we will pass back to Gloria. Bit of a lengthy one, so we'll see kind of which bits you want to pick out. But have you noticed any change since the statement you made earlier this year, or and particularly as it grabs so much global attention, but also since the bill was introduced in May? And I guess where else do you feel, you mentioned it in the last question, but I guess, where you feel Kenya needs to go to ensure we alleviate discrimination against women and girls due to menstruation, and I guess what can the rest of the world learn from what is happening in Kenya? Big question, so pick what you want. Sorry, we can't hear you again. Okay, we can hear you,
Yeah, sorry, it's a technical hit. I've noticed a lot of changes. There have been a lot of changes since the incident in February 14th in Parliament. For starters, there are a lot of more people who are actually talking about the issues that we have on period poverty. And the talking is good, because once we start talking about the things, then we are able to even discuss the solutions and brainstorm about how the communities can come together and really have a positive impact on their actions and creating that change. But the one visible thing in terms of governance is that we definitely moved the budget from 260 million, 940 million, just shy of $1 billion. So in the next financial year, we will have more schools and more beneficiaries of the government program on provision of free sanitary power. And campaign that was sort of started by people from the activists that happened also created a lot of interest, people wanting to push on the awareness of what period stigma is and period shaming is. So, you know, a couple of billboards were put up in Kenya, in the city center, the big high traffic areas. And this has actually helped reduce the stigma and the shaming that we have had over the years about women and girls menstruating in Kenya. I would also say that we have corporate organizations being able to sort of champion the cause and also, you know, asking themselves, what should we do as employers? As recent as the day before yesterday, there was an incident in Kenya where we had one of the managers, a quality assurance manager, actually, they were not sensitized well enough about menstrual hygiene management. And an employee happened to throw a used sanitary towel in the wrong bin. And this caused the quality assurance manager to basically summon all the girls and the women in that team and force them to sit down because she was trying to find out who is the person that is menstruating and why are you using the wrong bin. And then the whole conversation about, you know, that's not right, this is what you should do as a corporate in terms of menstrual hygiene management policy and the implementation of the same. So you find that things that would not often be reported or incidences that will be taken as normal, you know, harassment of women are having to deal with the MHM within their workspaces, things that would not be reported are now being reported and action is being taken. So I think if not much, I would say, the conversations that are ongoing in Kenya have really steered conversations across the continent in Africa. I have been to Ghana where we partnered with the Non-menstruator Foundation in terms of ensuring that we have advocacy around menstrual hygiene management in terms of ending the period stigma. So, I mean, the more we talk about it and the more the advocacy is out there, then the more we have different countries actually coming on board. I'm sitting right now in Tanzania, and I came here to meet some of the stakeholders and the champions in menstrual hygiene management. And one of the things that we are now working on is drafting a menstrual hygiene management policy for Tanzania. So I believe that so much has happened between the month of February and now. And I think the challenge for us is to keep the conversations going and to keep the goodwill that we have from the public and from the stakeholders and be able to rally that into actionable and tangible plans.
Thank you, Gloria. And yes, if you've seen her on LinkedIn, you will see the billboards around Kenya. They are fantastic. But yeah, that is quite shocking to hear kind of the practice at the workplace. And I guess leads very nicely into Olivia's. Yeah.
I pick on the previous question in terms of what would be the main, let's say, measures. I would put the following four on the table. One is emphasize more and better the human rights implications of the multiple human rights implications and deprivations resulting from poor menstrual health, but also leading to poor menstrual health. I think it is very important to frame this as a human rights issue that has enormous implications in the lives, health, well-being, and future prospects of girls in particular, but also women, in order diversity. And second, I would say men and boys engagement is fundamental. And I'm well speaking as a man on this issue as well. I think that the moment we are talking about taboo and stigma, men and boys have to do their part because they are one of the actors contributing greatly to the perpetuation of taboo, stigma, and gender stereotyping around these issues and using these issues to portray women as unfit for certain things or socially unreliable due to menstruation. The third element I would emphasize is what I spoke before about human rights. Now I would talk about the business case, making the business case on the socio-economic impacts of not addressing this issue properly, and the honorable senator was already alluding to that in her presentation, and I think that Olivia as well made a very eloquent case now in her second intervention about this issue as well. So I think that it will be very important to also make the business case work with the private sector as well. And last but not least, I think that empowering women and girls organizations to promote social accountability and holding governments to account will be fundamental.
Thank you. Yes, did anyone have any questions for any of our panelists? Hopefully Gloria can hear briefly. Yeah. There's no hands, Gloria, just in case you were wondering. That's not a problem. We will be around afterwards as well outside. But I don't know if anyone does come up, let me know. But otherwise, yeah, I do want to. Oh, yes. We have a question.
Should I put the mic up?
Yeah.
Sorry, I had just one quick question. Thank you. First of all, thank you to the panelists. Thank you for organizing this event. I just had a quick question. Many of you mentioned training and believing women, and especially when it comes to healthcare. Do you have recommendations in terms of how do we go about establishing training programs that actually respond to the needs of women and don't just perpetrate the same stereotypes and taboos that we already have in the medical field?
Thank you. Gloria, did you hear that? Did you want to answer? No, we can't hear you, sorry. Yeah.
So the question is how to set up training programs for women and girls in terms of menstrual hygiene management, right?
Yes.
Okay, so first off, how we are going about it in Kenya, or particularly with the programs that I am running, is you can't call. We have found that the outreach program in terms of trying to convene women and girls for this particular training, we have combined it with something that they are more interested in. For instance, we have classes on digital training, so on how to use computers and digital devices. We have also classes on business skills training, which the women and the girls are more interested in. And then within those classes, because we have to get them to a central facility, and they have to come voluntarily. So if you want your numbers to be high in terms of turnout, you have to look at the different localities and see what they're interested in. So through the digital training and through the business skills training, within the programs, we actually have a mandatory program around reproductive health that touches on a lot of other things other than just menstrual hygiene management. And we have also found that if you want the turnout to be stable in terms of maybe you have 2 classes per week or you have 2 engagements per week, then what we say is that at the end of every, let's say 5 weeks, then care pack, activity pack, to be able to provide sanitary towels for about up to 6 months for that. So you find that they come from training for 2 things. Either they are interested in the digital skills or the business skills, or they are interested in getting the dignity pack, which has about 6 months supply of menstrual hygiene products, about soap, face towel. So it's always, the issue is ensuring that there's some sort of incentive, because most of the women and girls that we are targeting, if you talk to them, they believe that they have enough information around menstrual hygiene management. Because this information or misinformation is passed on from, let's say, peer to peer, which often is the wrong information, or maybe through our traditional African settings, like someone who is supposed to be mentoring you. So if they have been using the wrong menstrual hygiene products, then you find that we pass on the wrong information. So in order to break that chain information, we have found that we have to incentivize the engagement, and that has proven to be 100% effective, if not more.
Thank you. And I think as well, to add on that, it's teaching about, I guess, feels like when you're menstruating or even just the menstruating body, you have this like superpower that you've just not been told how to use. I think that, it would be so empowering if we were actually taught about, the impacts that the different levels of hormones have, and actually, imagine we could tailor our life a little bit more to it, so we could choose when we have a meeting when our estrogen is higher, and we could be a little bit more reserved when, it's a little bit lower. So I think that really encouraging people to be so much more body literate and understanding actually where they are in their cycle. Again, actually knowing when you're fertile and you're fertile for 6 days and when you are, I think that, maybe that is a couple of decades away, but that would be really empowering, and, stems on to then being able to track it through tracking apps, which is another question, but also, the birth control as well. So there's lots to talk about from it, but I think that's all of the questions. Like I said, we will hang out outside the room afterwards. But yeah, thank you so much for everyone who attended, and I kind of think our last or closing thoughts is just to really question things. I think that, people who menstruate, like I said, live as a majority on this planet, and yet the menstruating body is an inconvenience rather than something the society is tailored towards. And just a few kind of points to kind of leave on is, your period is the only time someone will bleed for several days, and is expected not to talk about it. Menstruators are only fertile for 6 days, as I mentioned, of the cycle, and yet we're the ones on hormonal birth control. A bathroom is 50% prepared for a menstruator and 100% prepared for a non-menstruator. Menstruation is taxed as a luxury good, and period pain is the only severe pain we normalise. So thank you very much for everyone who attended in person, and for those who attended virtually, and hopefully we can talk about it outside. But yeah, thank you very much.